in unprecedented times. Now, if I had a penny for every time I heard that particular phrase nowadays, I would be a very rich person, and I'm willing to bet it's the same for everybody else in this room. In fact, speaking as a young person, if I can still call myself that, I don't think I remember ever living in precedented times. The climate is changing, sea levels are rising, the global economy is volatile. I mean, even as I list all of these things out, I can feel the tension in the room rising. The reality is, today we live in a world full of problems so complex it can seem like they have no solution at all. So how do we even begin trying to address some of these issues and answer some of these impossible questions? Well, if you don't mind, I'd like to bring us all back to a time in recent memory where we had to ask ourselves that very thing. When reports of the spreading of a mysterious form of pneumonia began to emerge from Wuhan in China. We had a lot of impossible questions to ask ourselves in January of 2020, but I think one that was on everybody's lips was a pretty simple question with an impossibly complicated answer. What's going on with COVID-19? The spreading of an infectious disease is an interesting beast. It's a phenomenon that can't be directly observed. You can't stand on the side of the street and watch one person infect another. Even in the most extreme of circumstances, if you were to see somebody sneeze on someone else who eventually became ill, you can never really know for certain that that was the exact moment of transmission. And that's just for diseases that spread directly between humans. There's a whole additional world of vector-borne diseases that use some other agent like mosquitoes to spread from person to person. I mean, we've all heard of malaria, right? Let's take humans out of the equation entirely. We can't forget all of the diseases that spread between animals, and even plants can get sick sometimes. When we zoom out to a global scale, all these different pathogens interact with each other and with other environmental factors. Human activities like movement and migration and fishing and agriculture all have an effect on this system too. And as if that wasn't complicated enough, the additional existential crisis of climate change is having an effect through things like expanding the global niches of many diseases. Mix all this together and more, and boom. We've got this invisible dance going on underneath our noses that we can't even see. If we weren't talking about disease, it would almost be beautiful. But we are talking about disease, and so we have a problem on our hands. How do we disentangle this messy network of interdependent factors and figure out what exactly is going on out there in the disease ecosystem? If this sounds like one of those classic impossible questions, then it's because it kind of is. So what can we do instead? We break it down and we guess. Now, for any of you in the room whose knee-jerk reaction is outrage at the idea that public health decisions could be made based on guesswork, bear with me for a second. I said we were going to make a guess. I didn't say it would be an uneducated one. Faced with a complex system that we can't directly observe, we play detective. We gather clues in the form of what little we can observe, like how many people are testing positive over time, or what the flow of movement is from areas of high infection to low infection, or what different variants or versions of a disease are out there circulating. We gather together all these clues and signals that we think will reasonably give us an insight into all the elements of this invisible dance. Then we build models using maths and statistics that relate what this information tells us to what's really happening out there. This is the game we play in the world of epidemiology, or more specifically, infectious disease modeling. Those models can look a little like this. Now, bear with me for a second. I know this looks crazy, and trust me, they can get even crazier than this. But all this ever comes down to is taking the basic rules of maths that we learned as kids in primary school, adding, subtracting, multiplying, and dividing, and using them to describe or set expectations for, first of all, how we expect all these elements and factors to interact or dance with one another, and secondly, how all of this relates to those clues that we're able to observe. Some of these expectations can be pretty intuitive too. For example, we would expect the number of people infected with a given disease on a certain day to be somewhat related to the number of people who were infected the day before. So we could take the value from the previous day, plus some new infections, and minus some recoveries. And when we're guessing at how many new infections there might be, we could take the total number of currently infected people and multiply it by some term for how infectious the disease is. So for example, here I've set the infection parameter beta to 0.4, so our 10 currently infected people spawn 4 new ones. That's how you can use maths to set expectations for how this hidden system is going to behave. But you can also use maths to relate this hidden system to those clues that I talked about earlier. For example, we could say what proportion of infected people we would expect to test positive for whatever reason. Here, I've said 0.5. So when we get 7 positive tests, we can estimate the total number of folks infected to be in and around 14. Finding clues, setting expectations, writing down maths to describe them. That's all it ever comes down to. Now, these, at least to me, are pretty common sense, but some of these other expectations and clues can be a little less obvious. Some of them are very interesting, though, and I'm just going to talk about one. Let's zoom in even further on this dance to the molecular level. Over time, as a virus spreads, the genetic code that makes it up adapts and transforms as it's adapting to its environment. It's like taking the evolution and natural selection that happened for humans over thousands of years and condensing it down to the space of months or even weeks. This is possible because viruses are comparatively much more simple beings than humans, obviously. In a way, this makes an already difficult situation even worse. For example, this is how we got all of those variants of COVID-19, which we all really loved. But at least nowadays, we're able to take snapshots in near real time using genomic sequencing of the genome of the pathogen as it's changing. And this genetic information is more useful than simply for spotting big shift changes like variants. All of this information can itself form one of those clues that I was talking about earlier. This is the principle of a field called phylogenomics. Basically, you can take these snapshots of how the virus has changed over time and build a kind of family tree of different samples that we've taken from infected people or even animals. Then the structure of this tree gives us an insight into what's going on out there in the viral population. This family tree, as such, can even give us a historical insight way back in time. And this wouldn't have been at all possible until relatively recently due to amazing technical advances in our ability to conduct genomic sequencing. Those improvements came from the field of genetics and genomics, so independent of the field of epidemiology altogether. So, I hope everyone is still with me. We have started with a problem on a global scale and gathered clues all the way down to the molecular level. Let's zoom back out and look at how we use all of this to solve the problem. We have all these different pieces of the puzzle, some very obvious, others a little bit more technical or in-depth. And we have models that relate what this information tells us to what we think is the truth of this invisible dance. Here's where we add in another secret weapon to the process: technology. Advances in modern computation allow us to take our models and our data or clues and make repeated strategic guesses at all the unknown variables in this system. So this could be how infectious the virus is, or how many people are truly infected over time, or where exactly a disease is spreading. Then we can see how our maths and our guesses align with the data or clues we've been able to observe. This process is called fitting, and thanks to today's super fast computers, we're able to generate many, many guesses at all the unknown factors of this dance, sometimes even millions in the space of mere minutes. In doing this, we can generate a range of values of all these unknown, unobservable variables that best explain the data or clues that we've been able to observe. This is how we can arrive at these very highly educated guesses, but also account for and quantify the uncertainty that's ever present in a rapidly evolving, difficult to observe system. And so, a little over 4 years ago now, as the COVID-19 pandemic was kicking off, epidemiologists all over the world, far smarter and more qualified than me, were faced with an impossible question. Brand new disease, so many unknowns, and high stakes. What can we do about it? What's going to happen? But by taking this impossible question, transforming it into its parts, approximating, estimating, taking advantage of what little we do know to make very educated guesses about the things that we don't, we can take this seemingly insurmountable challenge and meet it head on. And that in itself is just the puzzle piece of the epidemiological aspect. In the face of a deadly pandemic, so many other moving pieces had to come together. Frontline workers, people who developed antibody treatments, the eventual vaccines and more, all added together into one big puzzle that eventually got us through it. And in the context of these unprecedented times we seem to be living in, I think there's a lot we can learn from this approach. While in epidemiology we add and subtract and multiply and divide literal numbers to arrive at our solution, these handy little operators can be used on a much more macro scale to bring together lots of different aspects and completely transform an impossible situation. In today's world, particularly as a young person, it is so easy to fall prey to the nihilism and hopelessness when we look at all of the problems we are set to inherit. And maybe the process of infectious disease modeling that I've just described to you doesn't immediately jump out as a metaphor or something we can learn from, but I truly think it is. In fact, I think there are a number of home truths that we can extract from this entire process. Firstly, we've seen how all these different factors, clues, and puzzle pieces that don't hold the full solution can come together to solve a problem as complex as the spreading of an invisible disease. We've also seen how technological improvements can come out of the most unlikely of places and completely change the game, such as what we're able to do nowadays with genomic sequencing for the modeling of viral spread. And lastly, I hope that we can all agree that knowing a question is impossible shouldn't discourage us from trying to answer it. These complex problems are not going to have straightforward solutions, but by adding, subtracting, and multiplying and dividing all of these aspects from all of these different factors and places, we can still make a difference. Let's not let the only thing we take away from the pandemic be memories of Tiger King and baking banana bread. Let's learn from what we did right and wrong and take inspiration from this lesson that lots of little bits and pieces from the most unassuming of places can come together and tackle a very complex problem. The good news is there is no shortage of problems out there nowadays, and I'm hoping that from what I've just said, you maybe have a bit of faith that you can be a puzzle piece for one of them. So pick one, and let's get started. Thank you for your attention.